My name is Doug Morse, and this is No Stress Training. The topic of the video today is determining a patient's heart rate using the R to R interval on their EKG strip. If you're looking at a patient's EKG on a dynamic monitor in the emergency room or the CCU or telemetry, if you see the QRS complexes begin to move closer together, the patient's heart rate is increasing. If you see QRS complexes spreading further apart, you know that the patient's heart rate is decreasing. Well, we can place a mathematical precision on that concept. What we want to do is we want to look at the EKG, which is printed on EKG paper. EKG paper is like a grid paper. It's got little tiny blocks on it, and it's got slightly larger blocks. Each one of those slightly larger blocks, we call those big blocks, are 5 millimeters by 5 millimeters. The key to determine a patient's heart rate using just an EKG strip on a regular rhythm is to identify the number of big blocks that occur in one R to R interval. We do that by finding a QRS complex that falls on one of those heavy lines that delineates a 5 millimeter block and counting across the number of big blocks until we encounter the next QRS complex. Take the number of blocks and divide that into 300, and that'll give you the patient's heart rate. Essentially, if you line a QRS complex up on one of those 5 millimeter lines and then you count across each 5 millimeter line, each time taking the number of blocks that you've covered and dividing that into 300, you'll get a sequence that goes 300, 150, 100, 75, 60, 50. We get the sequence of numbers by counting the number of big blocks in one R to R interval and then dividing that number into 300, giving us the numerical sequence 300, 150, 100, 75, 60, and 50. This is a very useful way to identify a patient's heart rate because if you train your eye to recognize a normal R to R interval, which is between 3 and 5 big blocks, then you'll notice abnormalities in the R to R from across the room. You're walking through a room and you glance at the patient's cardiac monitor and you see abnormally wide R to Rs on the monitor, then you know your patient's become bradycardic and you can go over and investigate further. Same thing happens if you walk by and you see very, very short R to R intervals. You'll notice that your patient's become tachycardic and you can go over and investigate that EKG. Let's look at some examples. This is a pretty standard sinus rhythm. We'll identify a complex that falls close to one of the heavy 5 millimeter line blocks and then find the next QRS complex that occurs after it. When we count across from here, we count 300, 150, 100, 75. The next complex falls between the 75 line and the 100 line, telling us that this heart rate is between 75 and 100. This is not an exact way to figure out what the patient's heart rate is, but it does tell us that the patient's heart rate is within normal range. Here's another sinus rhythm, this one a little bit slower than what we've been seeing. Here we have a QRS complex falling pretty close to one of those heavy lines that we talked about. The next QRS complex is right here. And in between those two, we have lines at 300, 150, 100, 75, 60, and then 50. This QRS complex fell between the 50 and the 60 marks, making this patient's heart rate between 50 and 60, probably in the range of 56, 57, 58. This patient has a pretty slow bradycardic rhythm. Find one of these complexes that falls relatively close to one of the 5 millimeter lines, and this one's pretty close. They don't have to be exact. The next complex is way over here. By now it should become apparent that this patient's pretty bradycardic because of this extensively long R to R interval. When we count across on this R to R interval, we find that we get 300, 150, 100, 75, 60, 50. Well, the next QRS complex is way beyond that, so you know that this patient's heart rate is below 50. This patient's pretty bradycardic. This time let's examine a very fast rhythm. Find a complex that falls close to one of these heavy 5 millimeter lines, the big block lines, and the next complex is right here, very close to it. We know that this rhythm is pretty fast. Counting across from this initial point, we get 300 and then 150. Well, that complex falls just inside that 150 line, meaning that this rhythm is just a little bit faster than 150. The narrow complexes and the rate greater than 150 qualified this as an SVT rhythm. This technique can be used for waveforms other than just QRS complexes. For instance, a pacemaker. This patient has a pacemaker that's firing here and then firing again right here. We can determine the rate of that using the same technique, counting across the boxes. Here we have 300, 150, and right at 100 is the next pacemaker spike. That tells you that the patient's pacemaker is firing 100 times a minute. QRS complexes follow those pacemaker spikes, and thus the patient's QRS complexes are also at 100 a minute. The rhythm that we're looking at here is actually a third-degree heart block. We have a QRS complex here, we have a QRS complex here. Counting across the big blocks, we get a heart rate of 300, 150, 100, 75, 60, and then 50. This patient's heart rate falls between the 50 and the 60 lines, meaning that they're just a little bit bradycardic with their ventricular response. But concurrently, we also have an atrial rate. There's a P wave right there. There's another one here, there's another one here, and there's another one here. We can determine what the patient's atrial rate is by using the same technique, except instead of using an R to R interval, we're going to use a P to P interval. Counting across from this starting point, we get 300, 150, 100. This patient's atrial rate is almost exactly 100 beats per minute. So we've got an atrial rate of 100 and a ventricular rate between 50 and 60. This patient's in atrial flutter. QRS complexes occur here and here. Counting across to determine the patient's ventricular rate in 5 millimeter increments, we get 300, 150, 100, 75, and 60. Patient's ventricular rate is almost exactly 60. There's a completely different atrial rate though. Because the flutter waves occur here and here and here, we can use the same technique to determine what the patient's atrial rate is, what the rate is of these flutter waves. And what we have is a complex that occurs here and one that occurs right here. So we have 300 and then 150. This next complex occurs right here, very close to 300. This atrial flutter rate is close to 300 beats per minute. One word of caution. An EKG strip that presents an irregularity in its rhythm, like the PVC that we have demonstrated here, will give you problems with this technique if you don't pick the right R to R interval. For example, you'll want to avoid the R to R intervals that involve the ectopic beat, the one either before or after the PVC. Instead, identify those complexes that belong to the underlying regular sinus rhythm. And when you do that, you can use the R to R technique to find 300, 150, 100, 75, and 60 as this patient's heart rate. Sometimes the irregularity isn't limited to a single ectopic beat. Sometimes the entire rhythm is chaotically irregular, as in this atrial fib. It's very difficult to use this technique on a rhythm like this. What you'll have to do is take averages of many of the R to Rs, or with a practiced eye, pick out that R to R which appears to be the most average of all the R to Rs that are available. That will give you your best estimate for the rate on an irregular rhythm. Well, that's it. I hope it was useful. My name's Doug Morris and this is No Stress Training. You can find us on the web at nostresstraining.com. We also have a Facebook page. Go to Facebook and do a search on No Stress Training and hit the like button. We keep a pretty steady feed of EKG reviews, new cardiology studies, and just interesting articles related to health, diet, nutrition, resuscitation science, and anything that's new in the areas of ACLS, PALS, BCLS, 12-lead interpretation, and EKG interpretation. So thank you, and let us hear from you.